lost it, first of all. Okay, first of all, the policy of decentralization is good, or was good. And like you correctly said, this was promulgated early 90s, around 1993. So it's a policy which is now over 30 years. And in the policy formulation, there's what we call policy evaporation. So after some time, there may be a process of evaporation of a policy. So in my view, there may be need to have a comprehensive review of the whole decentralization policy so that we document the lessons over the years and see areas where we need to improve and then strengthen decentralization. But to a large extent, it has worked, because you recall when we still ran a decentralized arrangement, everything was done and managed from the center. And there was a disconnect, visible disconnect and palpable disconnect between the center and ground. I remember when I qualified as a medical doctor, I was posted to Bundibujo Hospital. And when I went, I actually refused to report and came and changed and worked elsewhere where I wanted. But I could see the center was disconnected. So when decentralization was introduced, there was empowerment of the local communities, whereby we put the governance structures at the level of a district, at the level, initially there were counties, but counties were abolished, then the sub-counties, then the LOCs. So the population is participating in the governance of their own affairs, instead of being directed from the center. I remember that time the head of medical services in the district was called a DMO. And people were saying a DMO is a daily missing officer, because they would be appointed by Kampala, they report in the district X and they come back. There is no supervision at the district level. But now with the decentralization, you have a political leadership at the district, full with the chairperson, with the council. You have a CAO who administers the technical services. So when you have a head of department for health, for production, for engineering and works, they are supervised. And while there may be challenges, but decentralization has by and large improved the way we deliver services to our people compared to when we're running the system in a centralized way. This has also increased the participation of the citizens in the management of their affairs at various levels, down to the local council one, because there are now many layers of leadership, district, sub-county, parish, and so forth and so forth. So there are positive aspects, and then they are able to supervise service delivery. A district like Kanungu, which was created out of Rukunjiri in 2001. If you have been to Kanungu, we are a hard-to-reach community, where you come from Kanungu, you go in a gorge and cross some escarpments. Now, when we made a district, and then we got our own leaders, and we are managing our own affairs, there has been rapid transformation in Kanungu compared to when, for instance, we were just a county under Rukunjiri, because even Rukunjiri was marginalizing us as Chinchizi. So, like this debate of creating districts, we have now put a moratorium as government on the creation of new administrative units. But in many areas, it is justified. A place like Kanungu. Honorable Simojo is saying Karamoja has many MPs, these overrepresented, but we must look at the terrain, the geography, and the space in Karamoja. If we are talking of representation, you can't compare it with Wakiso. Wakiso has TVs, has newspapers, has access to media and so forth. So even one MP can represent many people. Whereas in Karamoja, there are peculiar circumstances where there are these more nationalities that may need a voice in the parliament. So we have to look at the country because it's not homogeneous, and address all those concerns. So in my view, decentralization has been a positive policy which should be continued. But probably we need to have a review, because 30 years, we now have enough lessons to document so that we put on record the positive aspects that have worked. We also take note of the challenging areas, and then we modify and move forward. Like recently,
Honorable Minister,
yes.
you mentioned Kinkizi coming from Rukunjiri. What informed that decision? Because you've given the terrain, hard to reach, escarpments. Is that enough to warrant to have a district?
Yes, when you look at the geography of North Kigezi, the Rukunjiri, one, the geography itself, Kanungu, you may not appreciate how it is. The terrain, you know, you have this Rujumbora, Mpororo, Rukunjiri, which has Bahororo and Banyankole. Then across you have a big river. Then across you go to the land of the Wachiga, Chinchizi, which is geographically disadvantaged, the mountains and the hills and so forth. So even within the council of Rukunjiri, you would find our councillors who represent us, they would be marginalized for various, they say, oh, those are the people who cross the river, and then they would not get services. You find maybe the chairperson of the district can't come from Chinchizi because we are numerically disadvantaged. Then you find there are more councillors from this side. So even service provision, delivery of services, there would be disadvantage, plus ethnic undertones and so forth. So there was justification when we asked the president and the government, okay, let these people, in any case, they have a big population to constitute a district. So the point I was making is that in many cases, there is a strong justification to create an administrative unit to bring services, but also address some of the local peculiarities of the areas. So in summary, what I'm saying, the policy of decentralization, in my view, is good and has been positive, and it has worked, and it has improved the way we deliver services to the Ugandans.
Okay.
However, 30 years down the road, we can do a comprehensive review and then address some of the challenges. Like one of the challenges which we had discussed in the cabinet was even the pay for the leaders, especially political leaders. And I can say, for instance, we are not taking a decision to enhance the pay for the LC5 chairperson, LC3, those political supervisors, so that we further empower them to do political supervision. Because we are sending lots of resources to the districts. We are employing graduates, cows, Gomborora chiefs. So we needed also to empower the political leadership to do the oversight. So we are going to enhance the pay for the political leaders, including the RDCs, so that we strengthen the monitoring capacity for these resources which we send into the districts. And so I would vote for continuation of decentralization, but with a review so that we tighten the loose ends as we implement.
And before I get to Honorable Agnes, who appoints the district health officer? Who appoints the DEO, the district education officer?
It's the District Service Commission. The District Service Commission appoints, but the law provides that the center can provide technical support. Say if you are recruiting the doctor, the Health Service Commission can send an expert from the center to support the district. If you are recruiting the district engineer, Ministry of Works can send an engineer expert from the ministry to support, but the responsibility lies with the District Service Commission. So
in short, the center still has a hand in how things run.
Of course, it's not detached. There is an umbilical cord that links the center with the local governments, but there is some relative independence in terms of decision making at the local government level.